Our practice is devoted entirely to headache. We are part of the Department of Neurology at the Brigham and Women's Hospital. We work at Faulkner, though, doing headache. It's a referral-based practice. It's entirely outpatient treatment of headache patients, and we also run a fellowship training program. Well, the headache specialty actually is relatively new. The first credentialing in headache was in around 2007. The first specialists were credentialed, and the first programs for training headache specialists in 2008. There's only about 11 training programs in the country. The specialty is involved in treatment of all forms of head and face pain. The classification system that we use, for example, has about 300 different kinds of headache in it. I started out after neurology training in private practice. I would say probably 2 weeks in, realized that headache was about 40% of the patients that I was going to be seeing, and realized quite quickly that either I was going to tackle the problem of headache or I was not going to be very productive in private practice, and so that's what I did. If patients are having chronic problems with their headaches, I do recommend that they seek specialty care with some reservations. The problem is that we're turning out about 11 headache specialists a year for 250 million headache sufferers. So we don't yet have headache specialists on every corner. On the other hand, I think if a person has tried to manage their headaches, worked with primary care, and in essence worked their way through the system and is not better and they're still having difficulty and not functioning to their satisfaction, then yes, I think their headache should be evaluated by a specialist. I think the biggest misconception with regard to headache is that they're really no big deal, and that they're really not devalued by both non-patients and patients alike. Patients often believe that they shouldn't be in the office even talking about the problem. And yet these headaches are very debilitating and very limiting, something that really no one would want to have. So it's very interesting how they are so devalued and yet so debilitating. If I were to summarize our book, what I would say is that on the one hand, it's a book about headache. And so as you might expect, it contains everything you would look for in terms of classification, diagnosis, and treatment of headache. But in addition, Elizabeth and I have had many years of clinical experience, and I think that this hopefully shows through. We had the luxury in writing this of sitting down and talking together and kicking ideas around, trying to figure out how we would best explain things to people. What we run into is that we have very little time in the office, and we talk individually to patients about their individual issues. The book is kind of, what would it be like if we were able to tell everybody everything? How would we say it? What would we want people to know? The sort of backstory about headache. For example, what about headache and diet? What's the true story there? What about headache and therapy like Botox? What about how to work through the system, how to organize your management, how to talk to your physicians, how to get the best care? We think especially with headache, it's important for the patient to be a careful, savvy, informed, but persistent consumer to get the best results from the care system.